Hello, this is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. What I want to talk today about is thoracic outlet syndrome. I actually just had 2 cases here today, which isn't a common syndrome for people to come in with, but 2 cases today with thoracic outlet syndrome. Now, thoracic outlet syndrome, thoracic outlet is where the brachial plexus, or the nerve plexus that comes out of the neck and actually supplies the arm. It passes through what they call an outlet, thoracic outlet. That's the upper thoracic or upper back area. And that area can be encroached by a number of different structures in the body and actually put stress and pressure on the brachial plexus, which is the nerves that supply the arm, and reproduce the numbness and the tingling and the pain and sometimes the loss in fine motor control that these people experience. Now, what does medicine do for these things? Well, one of the things they do is give people muscle relaxers, painkillers, and in some cases what they do is they cut the first rib out to open up the area. Now, I can think of a lot better ways of dealing with thoracic outlet syndrome than cutting someone's rib out of their chest. So let's talk about the anatomy of the upper cervical spine and how all this interplays with the work that we do in the office, which is specifically correcting C1 and C2. These are the top 2 vertebrae in the neck, the atlas and the axis. The atlas weighs about 2 ounces. Whoops, I had it upside down. And the spinal cord flows down through that hole. Now, the brainstem is housed by C1 and 2, and one of the nerve centers in there controls muscle tone regulation, postural muscle tone regulation through the spine. So, one of the first things that happens when C1 misaligns and locks under the skull, the normal neck curve is a C shape, a backward C shape. The atlas becomes locked, it irritates the postural center, and the first thing that happens is the scalene muscles, which are these muscles on the side of the neck, they go into spasm, and it pulls the neck straight. So when you lose the cervical spine curve, the muscles in the side of the neck called the scalenes get tight. That's one of the things that can entrap the brachial plexus and reproduce the numbness, tingling, and pain people feel through the arms. And so instead of cutting your first rib out, instead of giving you pain-killing medications, instead of giving you muscle relaxers, what we want to ask, and what I think most people in society want to ask when they have health problems, is what's the cause? You know, people for the most part are sick and tired of having drugs thrown at them, swallowing them, and yeah, you may feel better for a while, but thoracic outlet syndrome is not a drug deficiency, it's not a painkiller deficiency, it's not a muscle relaxer deficiency, it's a postural problem that has its roots, in most cases, in upper cervical spine injury. So let's just go through this one more time. Let's take like a bird's eye view of someone's life. You have a car accident when you're 12, you're 18, you have another car accident, you're 22, you slip and fall in the bathroom on the tile floor, hit your head on the tile floor, 3 different traumas, you have damage to the upper cervical spine, and so when that upper neck locks out of position, like I was saying, it affects the postural muscle tone, and this can be an underlying factor that is the cause of thoracic outlet syndrome, that causes the muscles to become tight, which entrap the nerve and reproduce all these problems people experience. So what do we do in our office? We don't drug you, we don't take anything away, we don't give anything to you. We remove a structural interference to the nervous system so your body can naturally go back to how it should be. And so when someone comes into the office, we run them through a battery of tests, neurological tests, to determine, do they have one of these upper neck vertebrae locked out of position? Which one is it? So sometimes it's C1, sometimes it's C1 and 2, sometimes it's C1 and 3, everyone's different. And once we have that information, we'll then take a series of very precise x-rays that look at how the joints fit together. Now, why do we look at the joints? If a segment in the spine is misaligned and become locked, if we look at how the joint of the head and C1 fit because they're mirror images of one another, if that vertebra is out of position, the joint's going to be misaligned and we're going to see it on the joint margin, right? So you're either going to have the joints be even, one's going to be off, or it's going to be under. And so by looking at both sides of the joint of the atlas, we can tell exactly how you're out of alignment. And then what we do is we introduce a very specific, precise force into the atlas along the joint plane in the opposite direction of how it's misaligned. The goal is to get that segment back under control, keep it under control, keep it off of the cord so the body can then, from a neurology standpoint, start to function better. The body under its own control will start to straighten the posture. The muscles that pulled the body structurally out of balance, as the neurology gets back into them, the body will start to go through this corrective process, and in many cases these muscles have been tight that are reproducing thoracic outlet syndrome symptoms will start to reduce and in most cases eliminate. So if you're in the Los Angeles area, you want to come in for a consultation, we offer free consultation. We have 2 offices, one's in Carson, and that phone number is 310-324-6172. Then we have another office in Los Angeles, and that phone number is 213-399-7772. If you're outside the LA area, you can call either of those numbers and we'll be happy to find someone in your location. So hope this information was helpful for those of you who are looking for a natural alternative solution to drugging yourself for thoracic outlet syndrome, and we hope to see you soon.